Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? I'm a speech therapist, speech language pathologist. I was a student when I saw a person who had fallen 30 feet through a disused factory roof. They had skull fractures, multiple strokes, multi-organ trauma and multiple spinal fractures and had a tracheotomy. I was there to assess speech and review eating and drinking. Reading their notes, I imagined there would be serious issues. They were able to eat and drink with only slight texture modifications. They could speak using a speaking valve and had no aphasia, problems with understanding or finding words, or dysarthria, unclear speech. They seemed slightly amused and bored of my assessment, took my notebook and pen and wrote "I can write too" in flawless handwriting and handed it back. I finished placement not long afterwards, but they were expected to make a full recovery. I had to tell a 104-year-old patient that he was only the third oldest patient on the ward. He was really disappointed. The other two suspiciously died later that night. Not rare, actually the opposite, but something we don't see too often. I had a patient with early stage pregnancy and some minor bleeding. I did ultrasound and saw normal fetus but no heartbeat and told her that it was likely due to pregnancy just being at an early stage. I checked her ovaries and told her that I could print a picture of the fetus. I moved the scan back to the fetus and there was a clear heartbeat. During the minute or so that I was scanning the ovaries, the heart started to beat. I'm a nurse, and this happened at the hospital I work at. In the car park, a staff member got out his car and it started rolling. He reached in to pull the handbrake. From where I was sitting in my car, I didn't notice anything other than the car move, and the guy jumped back in his car. A few minutes later, a lady walks by and starts screaming. Turns out he had been pinned half inside his car by his car door, as his car had rolled towards the car next to him. He was unconscious, blue, not breathing. A bunch of us tried breaking into the car next to him to move it, and eventually when there was about 20 of us, we actually managed to push his car back enough for PPL to pull him out. Luckily this happened at a hospital, so the crash team had already been called. They did CPR. He lived. I have a somewhat rare condition called hemicrania continua, a migraine headache on one side all the time. I have an stimulator implanted to interrupt the signals. It was an amazing thing to have it turned on after surgery and be headache free. I was lucky to live near the #1 doctor for the syndrome. We walked in and he knew at once what it was. It took 5 years to get approved for the implant. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long, except one, clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. We call them elite suppressors, and they probably still benefit from being on HIV meds because it probably reduces chronic inflammation in the body. During my residency, I worked in a unit which did a lot of urology. We had a series of regular patients with urethral strictures, narrowing of the urinary passage, and they used to visit from time to time to get their strictures dilated. These veterans would eventually learn how to catheterize themselves. One of the patients, a young boy of 14 whose original injury had been a pelvic fracture in a road traffic accident, came to the O on a Saturday in considerable discomfort. I was on call and asked him what happened. I passed this catheter in and I can't get it out. What he was using wasn't really a conventional urinary catheter which has a balloon at the tip to keep it in place, that can sometimes get stuck if the channel to deflate the balloon gets clogged. But that was not the problem here. He was using an infant feeding tube because the conventional catheters were too big for his narrow passage. The feeding tube is just a simple tube with no swellings and no mechanism to retain itself in the bladder, so I didn't really believe him. However, I found that he was right. I couldn't get the catheter out either. The catheter was fitting so snugly in the stricture that he couldn't pass urine and his bladder had filled up like a balloon about to burst. We took him to the OR and did a suprapubic cystostomy, basically made an opening into the bladder from the abdomen. This relieved the pressure in the bladder. Next we passed a scope down the SPC and found that the feeding tube that he had used as a catheter had gone into the bladder and got knotted around itself. Every time we tugged on it, the knot was getting tighter. We had to cut it off below the knot to get the rest of the catheter out. We got the knot out from the SPC. Holy crap, poor kid. Had a patient come in with headaches and she was a young woman. Her entire body would go numb with these headaches. Got a CT. She has 3 separate tumors in her brain. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was. A worm which got stuck inside the tube. How the heck did the worm enter the bladder? Lab tech here. We see worms very often. Disgusting and interesting at the same time. Once when a female patient was submitting urine sample, a full worm worked its way into the cup. It was Ascaris lumbricoides. Gotta love the medical field. Creutzfeldt-Jakob disease without relation to mad cow, the prevalence of which is about 1 in a million persons worldwide yearly. I had a patient with that once. The neurosurgeon told me, I don't know why he was being seen by him. No surgery options, that they can't even confirm the diagnosis until autopsy, and they usually don't autopsy because they can't ever use the tools again. Seen a patient whose triglycerides were so high that it gave him pancreatitis. They talk about it in the textbooks, but it is extremely rare. It was due to a combination of causes, including drugs he was taking for HIV. Now the crazy thing was when we drew blood it actually separated and there was a supernatant of fat that you could see in the vial. My new doctor office called me about my latest blood work. She says that my triglycerides are 269 and that is too high. I say, you mean they are down to 269? Without the medication they are 5,000 feet. She say, no, you might mean 500. And I say no, 5,000 without. This is about as low as we can get it. Not a doctor but a fireman EMT here. We got called on a traffic accident one night and when we got there was a guy hanging naked from a branch 9 feet in the air and a pool of blood below him. What happened, as it was explained to us later, the car he was driving lost control, started spinning in the road and eventually hit a barrier and came to a sudden stop. Due to the centrifugal motion of the car and the fact he wasn't wearing a seatbelt, he came flying out the back window of his car, landed on top of the tree and kept falling downwards, losing clothes on his way out. So we get him down, put him on a stretcher and send him to a hospital. Sure, he was dead as there were no vital signs. Well, he survived and he comes and visits at the station every now and then. I'm really impressed that tree branches managed to rip all his clothes off. That sounds like something only possible in a cartoon. I was diagnosed with an ocular melanoma, itself quite rare, that went into tumor necrosis. My doctor said 1 in 5 million. I'd rather be boring. I'm not a doctor, but I am a patient who had an ACL avulsion. That's where your ACL is so strong that instead of tearing, it pulls a piece of bone off your tibia. Apparently it's pretty rare. As a dentist, we are used to seeing unerupted teeth still stuck in the bone, which we call impacted teeth. The third molars are notorious for this, and after them, the canine teeth also get impacted. We confirm this when we see the radiographs of the patient. I was seeing this radiograph of a colleague's patient who had a missing canine which we were expecting on find impacted. We were not able to find it and thought it was missing. On closer inspection, we saw it impacted just below the eye, lying horizontally. My dad somehow got a blood infection that, normally, only dogs can get. Is your dad a good boy? A nurse. We give an antibiotic called Rocephin very frequently for patients diagnosed with a UTI. The only complication I've ever seen from it is vomiting if it's pushed too fast. I had a patient transferred to me from our urgent care side who had walked in fairly healthy, but complaining of UTI symptoms. They had tested his urine, diagnosed him with a UTI, given Rocephin, and were planning on discharging him home with oral antibiotics. We still don't know completely what happened, but this is our best guess. We think he had a gram-negative infection that reacted to the Rocephin by lysing. The bacteria essentially exploded and raced through his body, putting him into almost instant septic shock. He had to be intubated and put on blood pressure medications to keep his BP high enough to perfuse his organs. His temp went from 98.6 to 104 in under an hour. A central line was placed because we kept running out of IVs to give medications. He was transferred to an ICU. I have never before visited a patient of mine in the ICU, but because of his drastic decline, I had to see him and know how he was doing. I cleared it with the ICU charge and visited him 2 days later. He was extubated and walking almost on his own. One of the fastest declines and recoveries I've ever seen. Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high quality stethoscope. They dumped a few bags of fluid in him in the ED before they were barely able to get a BP on him. Worked oncology for 5 years and I've had several with no discernible BP and one with no palpable pulse. That crap will make your own BP shoot through the roof. Had a veteran patient who had spina bifida on his problem list. Somehow he had made it though 20+ years in the military and didn't get diagnosed with spina bifida occulta, which is present at birth, until after he got out. Have also seen atrial intramural hematoma, blood between the tissue layers of one of the upper heart chambers, myxedema coma, end-stage hypothyroidism, which is quite rare in modern times, mid-aortic syndrome, calcified blockages of the major blood vessel of the body, looks like coral on a CT scan. In an adult veteran, it is usually a childhood condition. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric thought it was a panic attack except for the adult resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed a right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device, LVAD, was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts in athletic kids. This was only discovered after the advent of the LVAD because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery reimplanted so that it wasn't going to get squeezed like that again, but he got to keep his heart, and I hear he recovered and returned to playing basketball. Get his coronary artery reimplanted. I'm imagining you fishing it out of the wastebasket and fetching a stapler. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor but it doesn't advance as quickly as it should, so she gets a secondary cesarean section. Standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock. The parents start crying. We don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million. It's actually 0.3 per million, so I hope I'll never see such a case again. My research lab works on exactly these kinds of cases. Embryonal tumors are a nightmare for the family, but from a science standpoint, one of the remaining unknown frontiers, so to speak. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mum's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering but has lost most of her brain function. Holy crap. I am very glad I didn't know about that when I was pregnant. That is absolutely terrifying. I once saw an IV drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. I once saw a newborn baby who was a true mix of sexes, intersex. I was part of the meeting with the top pediatricians discussing the case. The patient's sex was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all, they used genetic analysis to analyze the chromosomal makeup. However, this showed a 50-50 mosaic of cells, some of which were XX, female, and some of which were XY, male. A very confusing case as to what to do next. Unfortunately, I was unable to follow this one up. I'm a vet. It wasn't the patient so much as the owners. A dog was brought in because it was giving birth. The only thing was that it was male. The woman, late 30, was screaming that she sees the head. In reality, those were his testicles. In the end, I had to sit and explain to her about the birds and the bees. I was a nursing student years back, and many of the students in my year thought that women pee out of their bags. Some of the people who believed this were old enough to have grandchildren. I'm the patient, but I have a type of mesothelioma that's extremely rare, pelvic cystic mesothelioma. I'm the 154th known person to ever have it. Sorry to hear that you're part of an incredibly exclusive club. Best of luck to you going forward. Medical student here. Had a 13-year-old who presented to our service with a heart attack. After we worked him up, it turns out when he was a toddler he had unidentified Kawasaki's diseases that went untreated. One of the complications is coronary artery aneurysm, which in his case clotted over and caused the heart attack. Overall, he got better but has to be on blood thinners for the rest of his life. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach and she heard something odd in his pulse blood flow. Went to the hospital that night and he had surgery to resolve an blockage which, if it had ruptured, he would have been dead in 10 minutes. All by pure chance. A guy with chronic kidney disease came to the OR in a delirium state. His consciousness rapidly declined and he went into cardiac arrest. Spent 7 minutes doing CPR while we corrected his potassium levels, the cause of the arrest. He recovered with no long-term brain damage, which is very dang unlikely to happen when you spend that much time brain dead. Some weeks ago we played a match of table tennis and he was okay. Good stuff. My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happened when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen, such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Sounds like some extreme version of toxic epidermal necrolysis, but this usually takes several days to kick in. Don't quote me on that, not a dermatologist here. It's just stuff I remember from med school. Not a doctor but a nurse. I work with a patient with CCHS, also known as Ondine's curse. It affects around 1,200-2,000 people worldwide. You know how you can generally breathe without even thinking about it? Well, people with CCHS can't do that. They are generally either on a ventilator or hooked to diaphragmatic pacemakers. It sends an electric pulse to their phrenic nerve, which then causes their diaphragm to draw a breath. Or they can do something called sprinting, which is just being off equipment for a few minutes at a time. If they focus on it, they can usually breathe in their own. There are a few other problems that are common besides just breathing, but I don't feel like listing them off. The most interesting part to me is the lore. According to French and German mythology, the nymph Ondine discovered that her husband had committed adultery because he had promised his every waking breath to her. She cursed him that so long as he was awake he could breathe, but if he ever fell asleep he would stop breathing and die. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.